Hypersexuality, is it an addiction? In the silence of the night, and in the corners of the mind where secrets nestle, there exists a desire that burns not for love or connection, but for a compulsive urge to repeat the act itself. A desire that overwhelms, consumes, and distorts life into a repetitive cycle of insatiable cravings. This is not mere lust. It is not about pleasure. It is a storm that blows through the soul, shattering tranquility and replacing it with an endless hunger. It is what is known in psychology as hypersexuality, or what some might call sex addiction. Hypersexuality is not just a state of high libido, as some may imagine. Rather, it is a state of compulsion. A person becomes a slave to their sexual impulses, unable to control them or delay gratification. The individual finds themselves returning again and again to sexual behaviors or thoughts, even when they result in harm to themselves or others, or when they contradict their values and beliefs. The reality of hypersexuality lies in its psychological depth. It is a disorder that manifests as an inability to regulate sexual desires. A person may engage in excessive masturbation, compulsive use of pornography, frequent sex with multiple partners, or even seek out risky and harmful sexual experiences. All of this occurs not because they seek pleasure, but because they feel compelled, driven by an internal force they cannot silence. Behind the scenes, the brain's chemistry plays a significant role. With every sexual stimulus, the brain releases dopamine, the hormone of reward and pleasure. Over time, the brain becomes accustomed to these intense levels, demanding more to feel the same effect. And thus begins a vicious cycle of chasing a fleeting satisfaction that never truly comes. The addiction here is not to sex itself, but to the chemical surge it triggers. It is similar to what happens in drug addiction or gambling addiction. The root is the same. The brain's reward system has been hijacked. But what causes this condition? The answers are complex. Some researchers suggest that childhood trauma, such as emotional neglect, abuse, or unstable parental relationships, can contribute to the development of hypersexual behavior later in life. Others point to the influence of modern society, where sexual content is constantly available and normalized, making it easy for individuals to fall into patterns of overindulgence. Loneliness, depression, anxiety, and low self-worth are all emotional states that may drive a person to seek comfort in sexual release, using it as a temporary escape from internal pain. Religions and ethical systems have long warned against the dangers of excessive indulgence in desires. In Islam, for example, sexuality is honored when it exists within the framework of marriage, but condemned when it turns into a destructive addiction. Faith is not an enemy of desire, rather it seeks to refine and guide it. True faith helps one build an inner fortress of discipline, resistance, and spiritual satisfaction that transcends mere physical gratification. From a psychological perspective, treatment for hypersexuality requires great courage and honesty. A person must first recognize the problem, then seek help. Cognitive behavioral therapy is one of the most effective approaches, as it helps the individual identify the patterns that trigger their behaviors and find healthier alternatives. Group therapy and support communities also provide a space for shared experiences and understanding, which help reduce shame and isolation. It is also essential to address the emotional wounds that lie beneath the surface. Many who suffer from hypersexuality carry deep wounds, a longing to be seen, heard, and loved. Sexual behavior may be their way of trying to fill that void. Healing requires rebuilding self-worth, redefining one's identity beyond physical pleasure, and reconnecting with values and life goals. Modern science does not view hypersexuality as a sin or a moral failure, but as a condition that deserves understanding and treatment. However, this does not mean stripping it of accountability. Responsibility remains, and recovery begins when one admits their need for change and is willing to take steps toward healing. In a world where sexuality is commodified, hypersexuality is no longer a rare condition. It is a growing challenge, silently affecting many, especially in the digital age where temptation is a click away. But behind every struggle, there is hope. And behind every fall, there is a chance to rise. The question is not whether desire is evil, but whether it is controlling us or we are controlling it. True strength lies in mastery, And healing begins when the soul reclaims its throne, above impulse, beyond addiction, and toward balance, dignity, and peace. If you enjoyed the video, don't forget to like, share it with your friends, leave a comment, and subscribe to the channel to get our latest videos.